Nasal and sinus cancer encompasses malignancies that arise in the nasal cavity of the paranasal sinuses. These cancers are relatively rare but can be serious and challenging to treat due to their location and potential to affect surrounding structures. Key features: types of cancer. The most common types of nasal and sinus cancers include squamous cell carcinoma, adenocarcinoma, and sinonasal undifferentiated carcinoma. Location: the nasal cavity is the space behind the nose, while the paranasal sinuses are air-filled spaces around the nose. Cancers can arise in any of these areas. Symptoms can vary depending on the location and extent of the cancer, but common signs include nasal symptoms, nasal obstruction, persistent blockage or staphynox in one side of the nose, nasal bleeding, frequent nosebleeds that are not related to trauma, nasal discharge, persistent or unusual nasal discharge, often with blood. Sinus symptoms: facial pain or pressure around the eyes, cheeks, or forehead, headache, persistent headaches that do not respond to standard treatments, swelling of the face, particularly around the eyes or cheeks. Other symptoms: change in vision, blur or double vision, or bulging of the eyes if the cancer spreads to the orbit eye socket. Difficulty breathing, problems with breathing through the nose or mouth. Hearing loss, if the cancer spreads to areas affecting the ear. Speech changes in speech or swallowing difficulties if the cancer affects the throat or palate. Causes and risk factors: several factors may contribute to the development of nasal and sinus cancers. Tobacco use. Smoking is a major risk factor for cancers of the nasal cavity and sinuses. Occupational exposures. Exposure to certain industrial chemicals and dust, such as wood dust, formaldehyde, or asbestos, can increase risk. Human papillomavirus (HPV). Certain strains of HPV are associated with an increased risk of cancer. Chronic inflammation. Long-term inflammation or infection of the nasal passages or sinuses may contribute to cancer risk. Genetics. The family history of cancer or genetic mutations can play a role in susceptibility. Diagnosis. Diagnosing nasal and sinus cancer typically involves several steps. Clinical evaluation, review of symptoms, medical history, and a physical examination. Imaging studies, CT scan, to visualize the extent of the cancer and its spread. MRI scan, provides detailed images of the soft tissues and helps assess the involvement of surrounding structures. Biopsy, removal of a tissue sample for microscopic examination to confirm the diagnosis and determine the type of cancer. Endoscopy, a procedure using a thin, flexible tube with a camera to examine the nasal cavity and sinuses directly and obtain biopsy samples. Treatment for nasal and sinus cancer depends on the type, stage, and location of the cancer, as well as the patient's overall health. Surgery. The primary treatment for many nasal and sinus cancers is surgical removal of the tumor. Depending on the location and extent of the cancer, surgery may be complex and require reconstruction of affected areas. Radiation therapy. High-energy radiation is used to kill cancer cells or shrink tumors. It may be used as a primary treatment or in combination with surgery. Chemotherapy. The use of drugs to kill cancer cells, typically used for more advanced cancers or when surgery and radiation are not sufficient. Targeted therapy. Medications that target specific molecules involved in cancer growth. This approach is used for certain types of nasal and sinus cancers. Immunotherapy. Treatments that help the body's immune system recognize and attack cancer cells. This may be an option for specific cancer types or advanced stages. Prognosis. The prognosis for nasal and sinus cancer varies widely depending on several factors. Cancer type and stage. Early-stage cancers generally have a better prognosis than those that are more advanced or have spread. Location. Cancers in more accessible areas may be easier to treat effectively. Treatment response. the effectiveness of the chosen treatments and how well the cancer responds. Overall health, the patient's general health and ability to tolerate treatment. Follow-up and rehabilitation. Post-treatment care is crucial for monitoring recovery, managing side effects, and detecting any recurrence of cancer. Regular check-ups, frequent visits to the oncologist for follow-up exams, imaging tests, and possibly additional biopsies. Rehabilitation, physical therapy, speech therapy, or other supportive therapies may be needed to address functional changes resulting from treatment. Conclusion: nasal and sinus cancers require a multidisciplinary approach to diagnosis and treatment. Management involves a combination of surgery, radiation, chemotherapy, and supportive care tailored to the individual patient's needs. If you have more specific questions or need additional information about nasal and sinus cancer, feel free to ask.